The next question, for some people who may be here, we're going to shift to another age. So for those that came in a little later, we've got a nice group here. Now we're going to jump to this question. How do you improve fluency in children versus adults? What a question. So the first thing that's important to know is that we treat children like children and we treat adults like adults. Too often we infantilize teenagers and young adults and adults in therapy that might be very childish. And too often we treat very young children in the same way we might treat an older person or an older child. The therapy has to be fit for the person that you're working with. My father always says, you don't get a pair of lips that walk into the room looking for help. It's a person. It's a family. It's a mother. It's a father. It's a brother. It's a sister. It's a husband. It's a wife. It's a person. So whatever the therapy is going to be, it has to fit the person. So when we're looking at young children in the preschool years, very often the stuttering is just a blip. It's just a little hiccup. They don't have a lot of stigma. They don't have a lot of horror. They don't have a lot of judgment about it. As children get older, developmentally, they start to size themselves up to others. At some point in the early school years, they start to think about, well, my backpack isn't the same color as Timmy's backpack. And as those things start to happen, that's when they start to think about, well, is that okay? You know, my hair is different, or my body image is not the same as everyone else, or my skin color isn't the same. In the early years, it doesn't make a difference. But as time goes on, they start to size themselves up and ask themselves, well, that's different. Is that okay? So that's how it starts to develop with young children. And then in the early school years, you start to get extra layers, not just of the physical issue, but non-physical aspects of stuttering. The experience of having thoughts about yourself, about your speech, about your ability as a communicator. You start to have feelings about speech during the moment of speech, leading up to a moment of speech, after a moment of speech. So preschool children generally don't have that, so we can work in a very different way. The approach can be very matter of fact. It can be mostly focused on the surface behaviors, on the physical side, and of course, giving the support as needed, as much as necessary, but as little as possible for the parents, and helping the parents be empowered to help their own preschool children. In the school age years, teen years and adult years, now we have to realize that the person is dealing with, or may be dealing with, a certain amount of the physical issue that presents, but also the thoughts and the feelings around that and how that affects their overall experience in life and in their self-image. So that really speaks to how do we differentiate the treatment between children and adults. In my opinion, it's preschool children, and then from school age all the way through adults, that's pretty similar. You need to gauge the person, how much of the work is above the surface. So we can think of Joseph Sheehan's analogy of the iceberg. On the surface, we can see the tip of the iceberg. Those are the behaviors that we can hear, a stutter, or we can see, tension or blinking or movements or things like that. Beneath the surface, what we often can't see are the thoughts and the feelings. There could be negative thoughts and feelings of shame, of guilt, of hiding, of inadequacy. It could also be very strong positive feelings of confidence, of conviction, of determination. Many people who stutter are very strong communicators and very strong people. That's not to say that everyone is, and that's not to say that every child is, but we need to look at each child and each person in their own way. And in doing so, we can figure out what proportion of the therapy should be based on physical strategies and what proportion should be looking at the non-physical aspects. So for one person, I say, maybe some of the work is going to be, let's say 20% on the physical strategies, physical speech strategies, and 80% is going to be working on the non-physical and thinking about how you think about yourself, of your self-image, of what you think are your 3 strongest attributes. And then thinking about, well, what are some things that are hard for you? Well, math is hard for me. I'm good in English and history, but math is really hard, and volleyball is hard, and sometimes talking is hard. So in that conversation, we're kind of reframing the way the person might be thinking or feeling about their speech and how dominant that feature is when they look in the mirror and look at themselves. So that's some of the non-physical. For someone else, they may have all the confidence in the world. And so they may just need 20% of working on that stuff, of the non-physical side, and 80% is really getting a handle on this mechanism, similar to a car engine. You may have a car that when you switch gears, or if it's an automatic transmission, it pops the clutch, it gets stuck. You might learn how to take care of the transmission so it works better, but also sometimes you got to accept the fact that this transmission has a little bit of a stickiness when you go from third to fourth gear. And in knowing that, it can make all the difference, because now you can learn how to drive that car knowing that, and still drive, because what you really love to do is to drive and get around and get out. And the big shame would be not the fact that your clutch gets stuck between third and fourth, but that you stop driving and you stop going out. So the work with adults and teens and older kids is the interaction and the integration of those two sides in the right measure for that client.